Hi, this is Haylee Henry, and I am going to be talking about urinary tract infections. The verse that I chose is Matthew 6:34. Therefore do not be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day is its own trouble. Alright, UTIs are infections along the urinary system. The urinary system includes the urethra, bladder, ureters, and kidneys. So common symptoms include dysuria, which is painful or difficulty when urinating. You're going to have a strong urge to urinate even after urinating. You're going to urinate in small amounts. Urine may be red from blood or white or cloudy from leukocytes. And pelvic pain is also associated with any type of infection. So infection at the urethra is called urethritis, and most common symptoms include burning with urination and discharge. Infection in the bladder is called cystitis, and pelvic pressure, lower belly discomfort, frequent and painful urination, and blood in urine are all very common. And infection at the kidneys is called pyelonephritis, and back and side pain, high fever, shaking and chills, and nausea or vomiting may be present as well. UTIs get complicated when it gets to the point of a kidney infection. If you have repetitive pyelonephritis, it can lead to scarring and eventually shrinking the kidney, and that can lead to kidney failure. So things that you do not want. 3 main words to really just sum up all of the signs and symptoms include dysuria, frequency, and urgency. Alrighty, what causes UTIs? The most common type of bacteria that causes UTIs is called Escherichia coli, also known as E. coli. These bacteria are rod-shaped, referred to as bacillus, and they can either be single or in pairs. Single, it would be referred to as monobacillus, and in pairs, it would be referred to as diplobacillus. E. coli is gram-negative, so it has a thin peptidoglycan layer, so when performing a gram stain test, the bacteria will dye pink since it's going to hold onto that counterstained safranin. So as you can see in the picture on the slide, the bacteria is stained pink. Those are E. coli bacteria. There are also some other types of bacteria that can cause UTI, but E. coli is most commonly the cause of UTIs. Alright, pathogenesis. Pathogenesis means development of a disease. So in terms of a UTI, bacteria enter through the urethra and travel to the bladder and then up the ureters to the kidneys. Worst case scenario, you don't want it reaching the kidneys, right? So in the bladder, the bacteria attaches to pili receptors, and this response can, at any point in the urinary system, it causes infection and inflammation. So that's where you get the discomfort and all the bad things that come with UTIs. Risk factors can be from diabetes mellitus. If you have diabetes, you're at an increased risk of getting a UTI, since typically diabetics have high blood sugar, so that means more glucose in their bloodstream, and it gets caught, in the kidneys and where urine is recycled and filtered through, so it's a really good environment for bacteria. Females are also unfortunately more likely to get UTIs because the urethra is shorter compared to in males. Urinary catheters, those allow bacteria to enter in very easily. Poor hygiene, that's a given. Dehydration, if you're not drinking enough fluids to really just flush out all the bacteria is going to thrive. Weakened immune system, your body's not going to be able to fight off the bacteria. And increasing sexual activity is also a way to invite bacteria, unwanted bacteria that you do not want. Alright, epidemiology is pretty much just incidence and distribution of a disease or an infection, anything like that among a population. So with UTIs, women are more likely to get them than men. As discussed previously, their urethras are shorter, so it's easier for bacteria to travel. Older adults are more at risk, just simply aging, weakened immune system. Sometimes, depending on if there's dementia or Alzheimer's present, they may forget that they have to use a bathroom, and therefore allowing buildup of bacteria. Older men are also more at risk because they have enlarged prostate glands, and that can obstruct the urethra, again, allowing bacteria to grow. 50 to 60% of women will have at least one UTI throughout their lifetime, unfortunately. Treatment and prevention is pretty straightforward. For urethritis, oral antibiotics are going to be prescribed. For cystitis, same thing, oral antibiotics are going to be used. Pyelonephritis, IV antibiotics are going to be the source of treatment, just because you need to be a little bit more aggressive with that one since it's an infection at the kidneys. Complications are higher, risk factors, it's a lot more serious. Prevention of UTIs, it sounds simple, sometimes it can be very difficult, but proper hygiene is really important, and hydration, just bottom line, hygiene and hydration. Christian worldview, how does this relate? Like, how do you look on the good side of things when, maybe you have an infection, maybe you have a disease? My favorite verse to look at is Matthew 6:34. Therefore, do not be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day is its own trouble. Pretty much just saying, why are you stressing about things? God is above everything, and He has plans for you. Don't stress about tomorrow. Tomorrow is already stress for itself. So you stressing about it isn't going to do anything. Just trust in the Lord. Alright, and then here is my reference page. Thank you so much for watching, and I hope you have a great day.